I'm Belinda Heinrichs, and I'm the administrator for the section for Community Health and Chronic Disease Prevention with the Missouri Department of Health and Senior Services. I'm pleased to be with you today to be able to talk with you about chronic diseases. And I want to begin with some information about homelessness in Missouri. As you know, homelessness is a growing problem in Missouri. The number of reported homeless persons in Missouri increased 12% from a total of 7,038 homeless persons on a given night in the winter of 2009 to 7,877 homeless persons on a given night in 2010. In other words, 839 more Missourians were reported as homeless in 2010 than in 2009. This data is from the 2011 State of Homelessness prepared by the Homeless Project research team of St. Louis University. The largest increase in homeless persons was in the Springfield Continuum of Care, where the reported total increased 58% from 418 in 2009 to 662 in 2010. The numbers of people experiencing homelessness increased in several of the subpopulations, specifically victims of domestic violence, chronically homeless, mentally ill, persons dealing with chronic substance abuse, and persons with HIV/AIDS. This figure presents the proportions of homeless persons in emergency shelters who identified their race. Statewide, approximately 41% of those in emergency shelters identified themselves as white, with an additional 36% self-identifying themselves as Black or African American. The remaining 23% identified themselves as other race, multiracial, or did not report their race. The vast majority, 95%, were non-Hispanic, non-Latino, while 5% identified themselves as Hispanic Latino. Now let's talk about chronic diseases. According to the Center for Disease Control, otherwise known as CDC, chronic diseases are those diseases that are prolonged and do not resolve spontaneously, and for which a complete cure is rarely achieved. Chronic diseases are long-term illnesses that develop slowly over time and for which a recovery is not expected. The resulting problems caused by chronic diseases include fatigue, loss of energy, sleeping problems, pain, trouble breathing, disability, and depression. According to the World Health Organization, chronic diseases such as cancer, heart disease, and diabetes have reached global epidemic proportions and now cause more deaths than all other diseases combined. The burden of chronic disease in Missouri is disproportionately heavy. The rates of chronic diseases and the risk factors associated with chronic diseases are consistently higher in Missouri than the U.S. as a whole. In addition, minorities in Missouri have rates that are greater than the statewide rates. Almost 1 out of every 2 adults has at least one chronic illness. Chronic diseases are the #1 cause of death and disability in the U.S., and treating patients with chronic diseases accounts for 75% of the nation's healthcare spending. African American, American Indian, and Hispanic communities have higher prevalence of obesity, diabetes, and heart disease than white communities. This slide points out the characteristics of chronic and acute diseases. Chronic diseases tend to develop and proceed slowly over time, lack a regular or predictable pattern, usually lead to more symptoms and a loss of physical functioning over time, and recovery is not expected. Whereas acute diseases typically have a rapid onset, usually have a single cause, and are easily diagnosed. There are shorter duration and respond to specific treatment, and return to normal life is expected. There are multiple causes of chronic diseases that vary over time. They include lifestyle habits such as smoking, lack of exercise, poor diet, and stress, as well as exposure to environmental factors such as asbestos and radon. And we also have to keep in mind what our genetic makeup is. But most chronic diseases are preventable. And as previously mentioned, these chronic diseases do share major risk factors beyond genetics and social inequalities. For example, they are tobacco use, physical inactivity, unhealthy diet, obesity, heavy drinking, lack of access to preventive care. The prevalence of these risk factors were all higher in Missouri than in the U.S. Overall, at least 88% of adults have at least one of 4 risk factors: tobacco use, physical inactivity, unhealthy diet, and obesity. In Missouri, chronic diseases are major causes of death. In 2010, 55,054 Missourians died, and about 71% of these deaths were related to chronic diseases. Heart disease is the #1 killer, and cancer is #2. Chronic lower respiratory diseases such as COPD is #3, stroke is #4, and diabetes is #8. Together, these 5 categories account for 74% of all deaths in 2009. The death rates for heart disease, cancer, stroke, and diabetes declined significantly in the last decade in Missouri overall, and among white men and women and African American men and women. However, the death rates for these 5 chronic diseases were higher in Missouri than in the U.S. In Missouri, the death rates were higher among African Americans than whites, except for the chronic lower respiratory diseases, in which the rates among African Americans was actually lower. This slide shows us the number of people who smoke and have chronic diseases. Of those adults who smoke, almost 30% have asthma, 26% have had a heart attack, and 24% have had a stroke. In addition, the majority of those smokers are either on Medicaid or are uninsured and have other chronic diseases such as diabetes, hypertension, and high cholesterol. This figure illustrates the relationship between education and risk factors and disease conditions. What we see is that the lower the level of education, the higher the prevalence of the risk factors for chronic diseases. For example, those who have less than a high school education have higher smoking rates, making them at greater risk for developing one or more chronic diseases. Now let's shift our thoughts to interviewing clients. Communication is key to a successful relationship, and people become very frustrated if they feel they are not being understood. So I wanted to offer a few tips for creating an environment for a more positive experience. A client-centered interviewing approach is one that is non-judgmental, non-confrontational, non-adversarial, and will help to establish a positive connection with the client and will hopefully promote change. It's important to be a good listener. Listen to the words and the tone of voice, observe the body language, acknowledge having heard the other person, and acknowledge the content of the problem, and respond by seeking more information. As intake workers, you are required to ask, do you or a family member have a chronic health condition? If the answer is yes, then the following two questions must be asked. Is the chronic health condition disabling, and is the client receiving services? So what does this mean? We've talked about chronic diseases, but I want to stress it's important to remember that a chronic disease does not necessarily result in a disabling chronic condition. So let's review some definitions. A disabling condition, as defined in Section 223 of the Social Security Act, is a physical, mental, or emotional impairment which is expected to be of long, continued, and indefinite duration, substantially impedes an individual's ability to live independently, and is of such a nature that such ability could be improved by more suitable housing. Bullet points B and C are the critical criteria for distinguishing between a chronic disease and a chronic disabling condition. In addition, a chronic disabling condition includes the term developmental disability, which means a severe chronic disability of an individual 5 years of age or older that is attributable to a mental or physical impairment or combination of mental and physical impairment, is manifested before the individual attains the age of 22, is likely to continue indefinitely, and results in substantial functional limitations in 3 or more of the major life activities. It's a lengthy definition, but examples of developmental disabilities include Down syndrome, cerebral palsy, spina bifida, and mental retardation. Also, the disease of acquired immune deficiency syndrome or any conditions arising from the etiological agency for acquired immune deficiency syndrome and a diagnosable substance abuse disorder also fall under the definition of disabling chronic conditions. After you ask if the condition is disabling, you are then supposed to ask if the client is receiving services. Generally, this refers to medical care, treatment, or counseling and support. Building on the question about a chronic condition, you may need to give examples. And one way to approach this is to ask, have you ever been told, and you can use any of the following examples. Have you ever been told that you have diabetes, either type 1 or type 2? Have you ever been told that you have a lung disease such as bronchitis, emphysema, asthma, or chronic obstructive pulmonary disease, or COPD? Have you ever been told that you have high blood pressure, heart disease, or heart attack, liver disease or hepatitis, stomach problems such as acid reflux or ulcers? Have you ever been told that you have kidney disease or vision problems such as macular degeneration or blindness, arthritis or other problems with your joints, or do you have difficulty walking? You will probably find that many of the people who are homeless have chronic diseases and are not receiving care. They may need information on where or how to access health care other than the emergency room. The Missouri Primary Care Association is a nonprofit organization dedicated to improving access to high-quality, community-based, and affordable primary health care in Missouri. The MPCA advocates for policies and programs that assure access to health care for all, especially for those who are uninsured or underinsured. The MPCA represents Missouri's community health centers and promotes the development of programs and systems that assist in the delivery of high-quality, accessible, and personalized primary health care services to urban and rural populations across Missouri. The community health centers are private, nonprofit, or public healthcare organizations located in or serving federally designated medically underserved populations. The charges for services at a community health center are discounted to patients according to a sliding fee scale based on family size and income. The community health centers serve as the safety net for the uninsured and the underinsured. Each community health center is governed by a local patient majority board of directors and provides comprehensive primary health, dental, and mental health and substance abuse services to persons of all ages, income levels, and insurance status, regardless of ability to pay. If you need to find a community health center in your community, you can go to the website listed in this slide. They are located throughout the state, and this web address will help you find one that is closest to you. Another resource is the local public health agency or the county health departments. They are located in every county, and they work to improve the health of Missourians, and they address a wide range of public health issues, from assessing the health risks of environmental problems to providing emergency services during natural disasters. The LPHAs, or county health departments, protect food safety by inspecting restaurants and grocery stores, work to control communicable diseases such as the flu and tuberculosis, alleviate chronic conditions including heart disease, diabetes, and stroke, and some provide comprehensive primary health care services to children and adults. The county health departments are located in each of the counties, and you can go to this web address to find the county health department nearest you. And once you get to the web address, you can enter the county, and it will tell you the location of that LPHA. The LPHA is an excellent resource if you just have questions on how do I handle a communicable disease, or does someone need immunizations, or where do we go for follow-up care. And I would encourage you to call them if you have any questions at all. So in closing, many people are living with chronic diseases, and these chronic diseases can be successfully managed and prevented. People who are uninsured or underinsured can receive treatment at a community health center, and you can locate them by going to the web address listed in this slide. The references that I used for this presentation came from the Homeless Project research team of St. Louis University and the Chronic Disease in Missouri Progress and Challenges report prepared by Dr. Shumei Yoon with the Department of Health and Senior Services. And I thank you for your time and would welcome any questions you may have.